Alex Yudovich, thanks so much for coming down to Hennessey Studios, man. I appreciate it.
It's a pleasure.
And now you didn't just like drive around the corner to be here. You actually traveled to come here, huh?
I flew in from Houston, Texas,
Houston,
where I was born and raised. And but it's good to be back in LA because I actually did live here for 4 years.
Tell me a little bit about that. So what brought you out to LA for 4 years? Around what time did you come out here?
I moved out here in 2010
Okay.
to do my pediatrics residency at Children's Hospital Los Angeles.
Huh.
So as I said, born, raised, educated in Texas, went to medical school at the University of Texas Medical Branch, and then wanted to get out of Houston because my father's a pediatrician and trained at Baylor College of Medicine at Texas Children's. So I looked at New York, LA. Luckily, I ended up here in LA because I had a great time, met my wife. Now I'm back in Houston.
So you met your wife here?
I did. We actually were set up on a blind date, and the place where we met was on a bench at Children's Hospital Los Angeles because she was a volunteer there. So we met and the day before our first date, but we met at Children's Hospital Los Angeles. So very special city, very special hospital for me.
So doing the math, 13 years? How long have you been married?
Well, we didn't get married till 2013, but
Okay.
but we met. We met 2 days before. Sorry, we met on January 3rd, 2011. So technically started dating in 2011, married in 2013, and now we've been married 8 years.
8 years.
Yeah.
So you waited a little bit.
Yeah.
My story's a little different. I met my wife and got married a month and a half later, but
Yeah.
just because.
When you know, you know.
You do, right? I guess you do. So when you're looking to do, because obviously I didn't go to medical school, right? You know, I wasn't smart like that in high school, right? I was a kid selling you like lollipops and stuff in school, right? That wasn't really in my cards, right? But it sounded like you said, your dad was a pediatrician, right? Mm-hmm. So did you know at an early age, like I'm talking like grade school, middle school, was that kind of what you thought you were going to do?
I think so. I mean, a lot of people were always like, oh, you'll be a doctor like your dad, right? And I was like, yeah, sure, why not? Mm-hmm. But the pressure never came from my dad. The pressure really didn't come from him. But, you know, in the end, it's a great field. You get to work with kids. You get to sort of guide parents through some hardships.
Sure.
And guide them through some things where, you know, a lot of parents lose objectivity with their kids, and you realize that. I realize that now as a father. Mm-hmm. You kind of lose objectivity, and so a lot of subjectivity, and you need someone to talk you off a ledge a lot of times, and that's our job a lot of the times, you know, to just bring back, get parents away from worries.
I got it. Yep. So after graduating high school, you're looking at where'd you go to undergrad?
I went to the University of Texas at Austin, Hook 'em Horns.
Got it, yeah.
It was a Longhorn, where I was also part of a group that got to take care of the live steer, the silver spurs.
Okay.
So I helped take care of Bevo, which was a really cool experience.
Yeah.
Being 20 years old and hanging out with a steer on the weekend.
So after that, I graduated and then went off to, and I'm making this very quick, right?
Sure.
It wasn't a quick process to go through undergrad, right? But so then you went to med school. Where'd you go med school?
Med school. So immediately after Austin, graduated, went to the University of Texas Medical Branch, which is the original medical school in Texas. It's in Galveston, of all places. And interestingly enough, I was there during Hurricane Ike, which displaced us. And so I got to do a lot of medical school kind of all over the state, in Houston and Austin, and in Galveston. So it was very, very fun.
And did med school come natural to you, or did you have to work really hard?
The interesting thing about me, you said, you know, you weren't that smart. Yeah. But really, I always found someone smarter than me and just sort of became friends with them and sort of said, hey, what are you studying, you know? And so in med school, I found a guy. I was like, hey, are you doing all the optional reading? Yeah. I'm like, oh, okay, well, I guess I will too. So, you know, just trying to keep up with others who I believe and perceive as smarter than me.
Sure.
So that's kind of always been what I did.
That's what I do now, right? Yeah, they say you are, right, the 5 people that you hang out with most, right? And so if you're hanging out with those 5 people in college, right, you're probably destined for success, I guess, right?
Yeah, and I'm proud to say most of my friends from college and even high school and even childhood, like they found success, which is great. And you know, while I went for the career path of medicine, you know, whether you're an entrepreneur like yourself, you know, success can be defined and redefined, and I think it's really important to redefine it as you go along.
I'm redefining my success now, right? You know, it's more about, I've always money motivated, right? So for a long time, I wanted to make a living and I wanted to make a good living. Now I'm trying to make a difference, right? So you start to, and as you start to make more of a difference, money has nothing to do with success, right? As you're kind of impacting people's lives.
You kind of learn that as you go along.
You do.
For me, I mean, part of going into medicine, honestly, was kind of like money anxious. I always wondered what being unemployed or between jobs, that was always something that was scary to me. I guess maybe because my dad always had the same job and had a job that was pandemic proof, I guess, if you will, or national emergency proof.
Yeah.
You always need a pediatrician. So when it came down to it, I think that was also one of the reasons I went for it. Just, steady. Now it turns out the pandemic, it was a little interesting being a doctor during the pandemic, but it's been a great field, and I'm grateful for my education and grateful for everything that I went through.
Now here's a question. So were you because when you're in med school, you're still young, right? You don't have life all figured out. Right?
You don't. You definitely don't. And honestly, at that time, when you're 22 to 26, as I was going straight from college, and so many people, there's so many friends who are in finance or whatever it is, making money, taking trips, and you're kind of like, I'm kind of studying for the next month. What are you doing? Oh, you're going where? Oh, that's fun. But the good news is everyone gets it in time, and now I'm doing those things now. It's just a little bit delayed. But there are certainly times, especially when you're doing poorly, if you did badly on a test and you're wondering, oh my gosh, am I cut out for this? And there's a lot of self-doubt. And that's what I tell a lot of young people who are wanting to go to medical school. While you're in it, you're going to say, why am I doing this? A few times, especially as your friends start getting paychecks, success, trips, marriage, whatever it is. And you might not be doing that, but we all know now in our wisdom that everyone is running their own race, and you got to just find your path, continue it if you think it's right for you, and stick with it through hardships.
Well, that's where I was going with that. Is you've committed, right? You've committed to this career. That's not. You just don't call audibles after you've got this debt, right, from med school. It's like you are committed, right? And so. That could be kind of scary for, a young, adolescence that's still, their brain isn't fully developed yet, right? Because you're not developed until you're 26. Did any of your friends from med school not pursue it after they graduated? Did any of them say, hey, you know what, this is not for me. I really want to be an entrepreneur, or I really want to do something different?
You meet a handful. I think it's happening more and more where people will finish med school and then realize, just with that education, there's a lot you can do in consulting or helping out a large corporation with just a very specific niche. So there are a lot of opportunities for those who don't want to practice medicine. For me, it was like, I made it all the way through. Now it's time to do a residency. It's time to practice and finally get to do my real adult job. I'm coming out at age 29. Finally getting my first real job at residency.
At 29. It's wow, right?
Yeah, and that's just me who had 3 years of residency and then 1 year as chief resident at Children's Hospital. But some residents have 5-6 years plus a fellowship, another 3 years. So there's some people who don't start their job till their mid-30s, their adult job, if you will, until their mid-30s. So it's an interesting career path. But once you're there and you have all this expertise, you have all this knowledge, it's really helpful. And especially, again, going back, everything for me goes back to the pandemic because it's all I've done for 2 years. Just being able to help, interpret data or again, guide parents or guide families with good information.
So now while you're in med school, do you have to choose, I want to be a dermatologist, I want to be a pediatrician, I want to be a brain surgeon, right? How do you start to pick the career path that you like to go down?
Well, certainly for me, pediatrics was always sort of hey, that could do that. But there is a thought process you have to go through. And for me, it was, do I want to be a surgeon or a doctor? And after a few days on the surgery rotation, I realized I'm going to be a medical doctor. I'll do more prescribing than cutting.
Okay.
And then the question was adults or kids. And I thought I wanted to be an ophthalmologist, and I spent a couple months doing ophthalmology and realized, oh, I don't need a stethoscope for this? That's odd. I've always been told you need a stethoscope.
But this is in residency, not med school.
No, this is in medical school.
Oh, so this is in med school. Okay.
And so then when the decision came, do I take care of adults or take care of kids, the decision for me came down to feet and poop, in that children and babies really, much cuter feet and way more tolerable poop. So that's how I came to be a pediatrician in the end.
Got it. So now I always wondered that, right? I always wondered that, like,
Yeah, it's a process. So the beauty of medical school is in third year, you do a few rotations of everything. So when you graduate, even though I'm a pediatrician, I spent 2 months on a surgical floor.
Yeah.
We do a couple months of emergency room medicine. We see intensive care units. We see psychiatry units. So we learn a little bit of everything, and we see a lot and learn a lot about pathologies of adults, of children, of humans.
I see. And so when you go to do your residency, how many years do you have to do that?
At least 3.
3 years, and you chose UCLA?
No, so Children's Hospital Los Angeles is
Children's Hospital.
It's actually associated with USC.
Okay.
And it's in Los Feliz.
Got it, yeah. And so while you're there, that's really more like on-the-job training, is that what that is?
Yes, it is. That's a perfect description.
Yeah.
It's learning as you go.
Shadowing other doctors.
Well, no, it's really taking responsibility. So you are the in charge doctor, you have a supervising physician, but you are a resident physician. The term resident physician came from literally the doctors used to live at the hospital since they were there so often.
Okay.
There's rules and regulations now where people don't live at the hospital anymore, but that is why you were called the resident physician.
Got it. Okay. And so as you were doing your residency there, you thought, okay, great, I'm probably not going to stay in LA. I'm going to move back home to be closer to my family, pick my dad's brain when I need to pick his brain a little bit. Is that the decision that you're making? Because your wife was here too,
correct,
or your girlfriend at the time, right?
Yeah. Mm-hmm. So that was the tough question at the end. Do we stay in LA or do we go home? Now, I told my then girlfriend on our second date, just so you know, I plan on moving back to Houston.
And where was she from?
She's from Los Angeles.
So she is from out here. Okay.
Yeah. And it turns out in the last, 8 years that we've been living in Houston, so many people have moved from California to Texas. So we were kind of the pioneers on that maybe. But no, the decision was always to go work with my dad. And that was the plan to work in the family clinic that he started close to 50 years ago. Well, he joined, but then it became solely his almost 50 years ago.
Yeah.
So it's been fun over the last 8 years getting to work with him.
Well, it's not too many people have a mentor like that, right?
Definitely. I feel blessed that when I did go into my residency, I had already learned so much by just sort of watching my dad, shadowing with him, and in college summers, med school summers, and finally in med school I got credit for it. So I definitely was able to focus on a lot of the esoterics of pediatrics because I already knew the basics.
Yeah.
Just by learning and watching my dad.
Well, that's what I'm saying. Like, as you're reading stuff in textbooks, right? A lot of stuff like for example, like in high school, right? I read about the Panama Canal, right? Well, a month ago, I went to Panama, right? And it's a whole different experience when you go and you experience the culture and the food and you actually see the Panama Canal and you get on a boat and you drive through the Panama Canal. Like, you know what I mean? Like, whole different experience. And so my point here is that as you're reading this stuff in textbooks, like a lot of this stuff is coming naturally because you can see your dad visually doing what is told in the textbook, right?
Definitely.
So you had that advantage, right?
Absolutely.
Yeah.
When I took tests in med school, that was the first time I was ever good, by the way, at testing. I was terrible before med school. Maybe it's because I finally was learning the things I wanted to. But I always think of when I would read a question, I would think of the movie Slumdog Millionaire.
Oh, yeah.
In Slumdog Millionaire, he gets presented with a question, and then he would go back to his life and how he learned that question.
Sure.
How he learned the answer to that question. And for me, I would read a question on a paper and say, I know that B is the answer because when this patient came in and did this, and I have a memory like that. We're very visual, and I sort of learn by experience.
Got it.
And so, I was, again, blessed to have had that opportunity to just watch my dad do his thing.
Interesting. So there's that old, I guess, saying or thought process where, when you're in the hospital or you go to the doctor, right, and in walks that young doctor, right, who's got jet black hair or you know what I mean, doesn't look like he has all the wisdom, right, of the senior, more wise doctor, right? So did you get a sense of that, like when you just finally broke into this, where people were like, who's this new kid, right?
What
do they know?
Even in residency and just out of residency, it was a lot of, you're a doctor? Yes, this is what a doctor can look like. We can be young, and we can know a lot. We don't have that much experience, but we do know what we're doing.
Got it. So what's something unexpected that you learned in med school that wasn't necessarily medicine related?
Oof.
Because, like, for example, like most doctors and most lawyers, right? You know, they're not the best business people, right? You know, but is there something that maybe come to mind that you might have learned in med school that wasn't necessarily medicine related?
Well, I think one of the most interesting things I learned in med school, the curriculum kind of changed a few years before I got to med school.
Okay.
And they implemented something called problem-based learning, and where we would learn cases, whether they were, I remember the first one was breast cancer, and the second one was Crohn's disease, and learning from doctors in small groups, and sort of learning the practice of medicine, and not just so much the what it says in the books, but how to talk to people, how to be empathic, how to ask the question, do you have hope, and just instilling things like that in people, because without hope, it's difficult to see a positive future. And in medicine, that makes a lot of sense with things that cancer, chronic diseases. You always want people to have hope, whether it's faith, in God, in a higher being, in spirituality, just having hope. And so I remember that was one of the first lessons I learned in med school, thinking, wow, this has nothing to do with sort of science, per se, but it has a lot to do with, the humanism in medicine.
So teaching you the soft skills of how to communicate and have more sympathy and empathy.
Yes.
Interesting. Yeah. That's probably like 60% of the battle, right? Like how you communicate things to family members and manage the expectations of their loved ones, huh?
Absolutely.
Yeah. So now you work a lot. You're a pediatrician. Okay.
Yes.
How many children do you think you have seen in your career?
I definitely in the thousands.
In the
sure.
thousands.
Yeah.
Right?
So I've been a pediatrician now for 10 full years. I can say, I graduated, 10 years, let's just say.
10 years, okay.
Which doesn't sound like too much compared to my dad of 50 years and other doctors with more gray hair than I. But 10 years
it's a long time. It is a long time. It's funny because like as a kid, I grew up on Long Island in New York, and most everybody in my little town went to Dr. Serrano. That was him, right? And Dr. Serrano, it was a very similar story to yours, right? So Dr. Serrano was an older doctor. Maybe when I was going to him, he might have been about 15 years from retiring. He's now since retired. But his son was the new kid on the block, and the son would come and see him, and that was also Dr. Serrano, right? And there was, this was like a little house. Like you went to like this, it was a house really, but they converted it into an office building, right? And he was like a staple. He's been there forever, right? People still go to Dr. Serrano if you look in Lindenhurst, New York. And I remember going there, right? And there's always the same thing. All right, great. Take your shirt off, like heart rate, tonsils check. Back then there was no COVID, right? It was just, we had colds and stuff. We would go. And the cure for everything was this pink bubble gum medicine that I would get. That was the cure, right? Like every time I would go to the doctor, like I would actually look forward to it because I knew that I was going to leave there with this pink. Do you know what I'm talking about?
It's amoxicillin.
Yes.
People still call it the pink medicine, the bubble gum medicine.
Yeah. So that's like, that was the cure for everything. And then if you didn't go to the doctor, Robitussin was the cure, right? At least when I was growing up. So that's still a thing, huh?
Well, we're trying to prescribe that pink medicine a little less nowadays. The new guidelines, for example, for ear infections is really try to avoid antibiotics unless it's severe and there's a lot of symptoms. So antibiotic stewardship is something that's really been practiced and really needs to be followed, because one day that pink medicine may not work.
Sure.
Yeah. If you're familiar with War of the Worlds, is one of my favorite references, and of course I have to tell people, no, not the book, the Tom Cruise movie, because otherwise they don't know. But eventually the bacteria win. these aliens come through and they can't penetrate through their force fields, but what does eventually penetrate are these bacteria.
Interesting.
And so one day when our antibiotics don't work, it's those bacteria that were here before us that may win the battle when it's all said and done.
Yeah, because nowadays, like if I go to the doctor, right, they want to avoid at all costs giving you antibiotics, right? And so what's the reason for that?
Well, just that. I mean, most of the things nowadays, viruses are way more common.
Okay.
When your throat hurts and it's red back there,
it's
way more likely to be a virus than a bacteria. And so it's a tough conversation sometimes because parents are like, wait, you're not going to prescribe my child antibiotics for the throat infection you told me you have? And I said, well, again, it's a viral throat infection. I say again, we never said it, but this is a viral throat infection. We did a strep test, and it's not strep throat. And it might hurt for a couple of days, but it should go away on its own. And of course, if it doesn't, please come back and we can retest. We can see what other things it is. But the amount of viruses that cause a throat infection or pharyngitis, probably 6+ that we can think of. I can tell you off the top of my head.
Yeah.
And strep is just one thing.
Sure.
So way more likely if your throat hurts. Now, this doesn't mean that if your throat hurts, you don't have to go see a doctor because it's a virus. Please don't take this as medical advice. I've been told I always have to say that.
You have to do,
But, it's just what we know now is different than what we thought back then. Back then, it was probably, hey, your throat looks red. Here, take the bubblegum medicine.
Sure.
But now it's, let's do this quick strep test. And if it's not strep, we feel pretty good that it's not strep. And, of course, if the doctor still thinks it's strep, there's a secondary test, a confirmatory test that can always be sent to the laboratory.
Interesting. So many years later, like when I had kids, my one son started to get seizures.
Oh,
right.
That's scary.
Very scary because it was our first child, right? And so it turned blue, and we're like, "Oh my God!" The ambulance comes to the house, and we thought it was a febrile seizure, right? That's kind of would be like the most common thing. And at that time, you really don't know, right? And as a parent, you're scared, right? And so, like you said, the sympathy and empathy of a doctor telling us, okay, what's going to happen? What do we do? And so it turns out we went to one doctor. They're like, I don't know, we need to do blood work, right? And then next thing you know, they started sending us to cancer doctors, right? And then, like, at that point, you really start to think about your life, right? It just like everything just kind of stops in a moment, right? And so here we are at a doctor. We're living in Las Vegas, and so we're going to see cancer doctors. And so they diagnosed him as having von Willebrand's disease. I'm not sure if you're familiar with that is. Okay. That was part of it. But then he also was diagnosed as epilepsy too, right? And so as they diagnosed him with the epilepsy and the von Willebrand's, now the practice began with the medicine, right? And so I remember putting him on Keppra, and there's probably like 4 other medicines, and we couldn't break it, right? And so then they're like, okay, we need to do something a little bit more. And so then they use steroids to try to break the pattern. And then my son gained a lot of weight at the time.
Sure.
And so we're like, screw this. We want to go see doctors out in LA just to get a second opinion on this. We were kind of going from one doctor to the next. And so eventually he kind of, what I'm told is he outgrew it and he doesn't have epilepsy anymore, right? Okay. But it was from the time he was like 3 years old to the time he was probably like 12, like we dealt with that.
Wow. Yeah. It's interesting. When it comes to febrile seizures, the most common is something called simple febrile seizures. And really, that's what a lot of people fear with fever is seizure. It's very few people. I mean, this is sounds different than what your son went through. But when it comes to simple febrile seizures, which is the most common thing, as you said, it's scary to see a child seize.
Sure.
But if it's always with a fever and it meets certain criteria, then we know that kid is more than likely going to grow out of it. And when I say more than likely, it's like 99% will grow out of it. And of course, it's scary because you can never predict. And, you can tell parents, oh, take ibuprofen, take Tylenol. But really, you can have a normal temperature of 97.
Yeah.
And it goes up to 99, which isn't technically a fever. But if it goes quickly enough and the child has the gene for this, they will have a seizure. So really, safety, precautions, and education is really so important, especially because, you start thinking about seizures and lifelong problems. And, I want my child to scuba dive. He can't scuba dive. Scary thoughts like that. But you just stay present and always keep your child objectively. How does he look when he's sick? It's just, again, it's hard, but you got to keep that objectivity sometimes.
Oh yeah. And so we would do we'd go and they'd do these EKGs, right?
The EEGs.
EEG. Yes. I'm sorry about the EEG. And so he'd have to wear I don't know,
electrodes,
40 things coming off of his head, right? And then we'd have to take him home like that, and he'd have to sleep overnight, right? And so it turns out that he was never really good in school either, right? Because what happens is the first time that we seen him seize, it wasn't convulsing or anything like that. He was he just turned blue and he couldn't talk and he would just freeze, right? It was really weird, right? That was real scary. But then later on, what we learned after all these different tests was that he had something called epileptic sleep something. I can't remember. It's ES is an acronym for it. But it turns out that he was having seizure activity while he would sleep, right? And so he wouldn't get that deep sleep. The deep sleep, right, where your memory and stuff, and so he had a hard time in school as a result of that his whole life.
There's a great field that's growing of sleep medicine, both for adults and for children. Without a good night's sleep, kids they can struggle in school. They can struggle with behavior. They can struggle with memory. Yeah. And so it's always important to rule out medical conditions like that. So it's great. That's why EEGs are done awake and asleep, because it's very important.
Yeah, my wife will kill me if she's like, I can't believe you didn't remember what it was. I don't remember. So
whatever. It's gone now, right?
It's gone now. So. Yes, it's gone now. So what are some other things sugar, right? Let's talk about sugar for a second, because that's a thing that a lot of kids take, and I would imagine that is a drug, right? Isn't it?
I believe sugar is a drug. It certainly causes the same effect in the brain, a dopamine release.
It does.
It's the same thing as drugs, and certainly kids are addicted to sugar. I often tell patients, if you cut out sugary drinks for 3 months, which sounds like an eternity for a child, and for an adult too, 3 months of your life, and 3 months later you taste that sugary drink again, you're not going to like it. First of all, the taste is going to be whoa, because it's not the taste that you like, it's what you get in your brain that you like. It's that reward.
Interesting.
And so, yes, sugar, in my opinion, especially in a drink form. I'm looking at your drink. I hope there's no sugar in there.
There is no sugar in this.
Thank goodness.
Yes, unsweetened black tea. Yes,
super important.
Because this, if it had raspberry flavor or something, it's a lot of sugar.
Yeah, for sure. And you look at, often tell patients, if you're going to have a snack, you should really limit it to 200 calories. And if you look on a 20-ounce can of Coke, for example, a 20-ounce can of Coke has over 200 calories.
Sure.
So what are you supposed to eat? Because your snack is supposed to be 200 calories.
Yeah.
So it sneaks up on you. It causes a lot of insulin release. Causes a lot of obesity related issues. But really, it is essentially a drug.
And cancer too, right? Sugar, right?
Well, certainly diabetes and heart disease and things like that. I'm not sure. I'm personally not sure of any links to cancer.
Okay, then maybe
if there are, I certainly. Okay. I've been so busy with the pandemic that I don't know about links to cancer. But perhaps.
So now it's easy, right? So the doctor comes in and says, "Hey, stop taking sugar," right? But it's really hard to hold people accountable, because parents, it's you go to a birthday party, everybody's eating cake, right? Oh, a lollipop comes in the gift bag that you take home. It's like society is setting us up to fail.
Agreed.
Right.
There's so much marketing out there. Marketing versus medical advice.
Sure.
And milk does a body good. Got milk. But do we really need milk?
No, there's a lot of sugar in milk, right? But that was the thing when we were kids. Drink milk. They give it in schools, right?
Milk has. I'd rather a kid drink yogurt drinks than drink milk, or eat yogurt, or cheese. But when it comes to that, it's the same thing as screen time. It's the same thing as anything. You got to have limits.
Sure.
And so my kids eat sugar. We have donuts every once in a while for breakfast, but we certainly don't do it
every day.
And we certainly don't do it once a week. But every couple of weeks, if they haven't had donuts and the kids are like, "Can I have donuts?" Yeah, why not?
Yeah, you can't deprive them of living.
And also, look, we had donuts this morning. We're going to a birthday party. Let's have one piece of cake. Let's avoid the lollipop now. Let's maybe have it tomorrow.
That's
just
right.
with time.
Yeah.
Now, Halloween candy, that's a different story. I don't know how to set limits on that.
You just make exceptions during that 1 week, right? Yeah. Here's another interesting thing, right? So, you got a kid, goes to school, he's got ADHD, all right? You kind of know where I'm going with this question, right? And he's not really configured to do well in school because his mind is racing and he's thinking about other things, and who eventually might be able to kind of like innovate something in the world that the whole world needs because of his creativity and the way he's wired, right? Like that, right? So now the schools instantly are like, hey, we need to do something about this kid because he's distracting class, right? And so what do they go towards, right? Medicine, right? And then it takes that kid from being who he is, the true identity of that person, to being somebody that kind of fits in the box of a kid that should be sitting well in school. Like, I'm just curious about your thoughts on that.
Well, I will tell you, the way you just framed it is something that a lot of parents say. I don't want to make my kid a zombie or whatever it is. I want him to be who he is.
Yeah.
And the truth is, a lot of schools will bring up the diagnosis of ADHD at age 4, which it's a little early to say that. But as kids get to first grade, especially kindergarten, first grade, you start to realize that those kids, it's not that who they are is the problem, but the way their brain is wired certainly isn't allowing them to focus.
Sure.
So what I'll say is, studies after studies have shown, especially for kids 6 and up, medication is really the gold standard. And now 1 out of 3 kids will need medication going into adulthood. But we all know those people with ADHD in adulthood, and they're pretty successful most of the time.
Right?
And even if they're on medicines, they're successful. And if they come off of medications, they can be successful. For me, I remember learning how to learn in middle school. Like, that's when I learned how to learn. And that's what I tell all my patients. Middle school, really just practice learning. And if your kid can figure out how they learn in middle school and they can come off medication, great.
Yeah.
But there's side effects to the medications, but they're really well tolerated. It's the medication you can not give on the weekends, for example. Again, talk to your doctor about your individual cases. But there's a lot of hesitation to put kids on medicines from parents, but then immediately after they go on the medication, the benefits are immediate for those children, and they can focus more.
Sure.
And they can learn more. And while, yes, the one-size-fits-all approach to school clearly is not the best.
That's right.
The medications can certainly, again, not make them fit in the box, but do better for themselves.
And it's one of those things. It's like, you're damned if you do, damned if you don't. There's no right or wrong answer here, right?
And that's the beauty of parenting. There's very few wrong things. We know what is wrong. Like, please don't hit your children.
Sure.
Please don't put them in imminent danger. But the good news is, when it comes to medicine like that, you can start, you can change, you can stop, or you can watch and wait. And eventually, with most parents, with the watch and wait approach, like, okay, you're 6 and we diagnose you with ADHD, they're not ready to start medicine. Eventually, it sort of becomes like, okay, maybe we should start it.
Sure.
And then when they start it, it generally goes well.
Sure. Yeah, like my sister-in-law was dealing with that with my nephew, and she got advice, and people like, don't do that, don't put your kid on a drug. It's gonna make, like you said, make them a zombie, make them not who they are. And then in her case, it actually worked out well. I mean, it gave him more focus. He did better in school. And hey, that was the right solution for him, right, at the time.
Definitely,
right?
and at that age, too, it's just so helpful. Whether it's ADHD, whether it's anxiety, the same stigma sort of is with anxiety medications or depression medications. I don't want to be a zombie. I want to be who I am. But it's not changing who you are. It's changing chemicals in your brain. And when your chemicals are neurotransmitters are imbalanced, it really affects you. And by putting them back in balance, of course, pills are not the magic bullet. And this is what we learned in the pandemic. Well, we're waiting for this, we're waiting for that. But behavior change is what really makes your life better, what makes your life healthier, going back to sugar, right? If you have diabetes, the treatment is not just taking medicines, it's behavior change. It's taking in less sugar. It's doing more exercise. So same thing with ADHD. If the pill isn't everything, the pill is going to help them learn how to learn. And that is so key.
Sure. You know, and then you think about like the complete opposite end of the spectrum. Like most of the music that we made in the 70s was all based on drugs, you know what I mean? Like illegal drugs, right? Well, I don't think we would have had a Bohemian Rhapsody if it wasn't for some kind of like, you know, like...
Well, there's a psychedelic revolution coming, not for kids, but for adults. So many psychedelics are being used for refractory mental health problems.
Oh, yeah.
Oh, yeah.
Yeah.
Ketamine clinics and maybe even LSD in the future. Psilocybin, which is the active ingredient in magic mushrooms. So there's a lot of good things out there that are being studied carefully and slowly and methodically, that maybe going from illicit to prescribed.
Well, we had a guest on the show that got like really bad headaches, right? What was the name of it? Yeah, Joshua edited that out. He had really bad something called cluster headaches, right? I'm not sure if you're familiar with it. I remember that
from med school, of course.
Oh, yeah. So cluster headaches, and it was like a thing where he's like, his whole world was shutting down, and so that's his thing is LSD, and like he goes to like these like Las Vegas conventions and learns about it. But yeah, it's fascinating.
Fascinating stuff. And all that comes from nature, by the way.
It does, right?
Yeah, it's amazing.
Yeah. So, well, interesting. So now we talked about, you know, college, med school, you know, being a pediatrician for over 10 years now. But I understand you're doing a lot with schools lately. Tell me a little bit more about that.
So during the pandemic, there was a lot of hysteria, a lot of fear.
Okay.
And what I realized was, I immediately at the beginning of the pandemic, I was asked by a patient's mother who happens to be the head of school where my kids go for preschool to be on the medical task force. And so with the help of another physician, shout out to my friend Kat Chen, we put together protocols to keep the school safe and keep it open during the pandemic. And we were very successful. We used the CDC and American Academy of Pediatrics guidelines, and we had a successful school year during 2020 to 2021, which could not be said for a lot of schools.
No.
Especially here, and I know in California it was virtual pretty much all year.
And
in Texas, a lot of my patients were virtual pretty much all year, but I was blessed that my kids, with a very robust and layered approach to mitigation strategies, I can tell you that when they're put into place, they work. And so I had a lot of fun, doing that. It was a lot of tedious work, time away from my wife. Shout out to my wife. And so I got pretty passionate about that.
Yeah. How many children do you have?
I have 3 kids.
And how old are they?
Almost 6, and then 4 and 2.
And so just the 1 6-year-old boy or girl?
I have a Fiona as my oldest.
Okay.
She's almost 6. She said, have fun in LA with your cast pod. And then Benson is 4 and Lucas 2.
Got it.
Yeah.
So your 6-year-old, right? So with this pandemic, because I've got a 5-year-old daughter as well, like most of their life has been like COVID,
yes.
right? At least what they're aware of, right? Wearing masks, right?
And my kids wear masks really well. And it makes me very proud. I was able to take them on trips during the pandemic. And they're very excited to almost be done with masks. I believe today the CDC is going to loosen mask guidelines.
Here in LA.
I think the CDC is going to announce nationwide today.
Is that right?
Very much appropriate for me to be here today.
Interesting. Okay.
But yeah, that's all they know. I told my daughter Fiona this past week that she has a virus. I also had it. My tonsils were red, and it was not strep.
Yeah.
And she did too. And my son says, "Oh, Fiona has the virus?" And I said, "No, she doesn't have the virus. She has a virus. It's not all coronavirus, people."
That's right.
And we're coming out of this, thank goodness. It's been coronavirus for 2 years, but we're starting to get back into childhood illnesses.
Yeah.
Which is good, I guess.
Yeah. So I wonder if, I'm unsure if the schools are applicable to that. If the CDC says it's okay, it's still up to the school's discretion, or?
Correct. I mean, in the end, it's the school districts. But if the federal government is saying it's okay, then it sort of gives us a little bit more leeway on these advisory teams, or really at the local level, to say okay, it's okay to scale back because the CDC says so. There were a lot of people pushing for people to scale back well before the CDC, as we know, and a lot of parents, getting involved because of feelings they have about masks, as opposed to the true issue at hand, which is a communicable disease that for a long time didn't have a vaccine.
Yeah.
And for a long time after the adults were vaccinated, the kids still were unable to be vaccinated. And school, as you and I knew it from being children, wasn't a safe environment. If for adults, the workplace was supposed to be a place where COVID was not supposed to spread, school should not be a place where COVID should spread. Or at least that's the idea that I thought we all had, but some people felt otherwise the last couple of years.
And what's your personal feeling on the vaccine?
I've never seen a vaccine with such effectiveness in the history of vaccines. It's amazing. I'm blessed. When at nighttime with my kids, we talk every night. We finish the day with 3 things: your favorite part of the day,
gratitude,
your hardest part of the day, and what you're grateful for. And my default, when I can't think of something germane to the day of what I'm grateful for, I say my education. Because in a world where knowledge is power, which has always been said, nowadays there's a free flow of information. You have to sort of choose what's right.
Sure.
But having read the phase 1, phase 2, phase 3 studies put out by Pfizer,
which most people don't.
Right, and peer reviewed,
right,
and being able to say like, hey guys, this is safe. This is effective, and I understand maybe you don't understand the technology, but it's not a new technology. It's been around for years. And I'm also blessed to have a friend who's a nanotechnology scientist. So when it came to nanoparticles, I already knew a lot because I got to chat with my buddy Asaf. So, it's what I'll tell you is it's a vaccine. Vaccines have been effective for 200 years. It's a technology that's been around for 200 years. The technology started with pus being injected into a child. A scientist named Edward Jenner. I call him my favorite Jenner. His son, he injected his son with pus, and basically that was the first vaccine, if you will.
Okay.
And then it turns out that's the basis for the smallpox vaccine. And nowadays it's not pus being injected into people, it's mRNA inside of a lipid nanoparticle and giving near 100% protection from severe COVID-19, which is pretty crazy.
Yeah.
In a good year, just to put it in perspective, the flu vaccine gives you about 30 to 60% of protection against severe flu, and this vaccine is giving 90 to 100% protection against severe COVID-19. It's like hard to argue against it.
Yeah. So there's so many, and I would argue, right, and that there's people that also are educated that have a completely different belief than you do, right? And I'm just curious, people will claim that they've gotten Tourette syndrome because they got vaccinated as a kid, right? That's their true belief. And maybe that was the case, right? But does that mean that everybody should not get vaccinated as a result of that, right?
Well, the big one is autism.
And
AntiVaccine Sentiment didn't start in 1998, which is when and now no longer physician published a paper saying that measles, mumps, rubella vaccine is linked to autism. But the damage was done. And there's so many studies that have shown the measles, mumps, rubella vaccine is not linked to autism. And there is no link from vaccines to autism. If people believe that, they believe that. And anti-vaccine sentiment started in the 1800s. But it's interesting that 200 years later, people are still fighting against a technology that's only gotten better and better.
Yeah.
But autism, just real quick with autism, we do have a lot of people who are still concerned for that when all these different concessions have been made. The MMR, the measles, mumps, rubella vaccine causes autism because of the preservatives in it. So then the preservatives were taken out. And then it was, you took out the preservatives because it was causing something.
Yeah.
And now it's not causing it. Well, it never was. By the way, that preservative was aluminum based, and there's more aluminum in breast milk than there is in one injection.
Interesting.
Yeah, much more aluminum in human breast milk than in a dose of the measles, mumps, rubella vaccine. So unfortunately, people base their beliefs on their experience.
That's right.
And it's hard to take that objective approach, especially if something is statistical, and the side effects are 1%, but you're the 1% that got it.
That's the thing.
Yeah, so that's the fear. People are always fearful of being that outlier. And
it's where you consume your media and where you're doing your research is where you start to put your beliefs behind, right?
And especially nowadays, you can you find yourself finding more of what you already believe. And we know, I mean, literally in Space Jam 2, the bad guy was an algorithm. Like, that should tell you something. So, yeah. And also, I talked to a fellow physician who could not convince a patient to get a COVID-19 vaccine. And the excuse was, I watch Fox News.
Is that right?
Yeah. And so if we don't want to say that part specifically, it's I consume, my news source tells me not to, basically. And, you know, how do you convince somebody? The answer is you don't. You just tell them, this is what I recommend, and when you're ready to talk about it, I'm here.
So now, what's your thoughts about other countries kind of almost like going to make it like the law, where you have to, like, it's not even a choice anymore?
Well,
right?
It's interesting. Again, we're halfway blessed here in the nation because we may be getting herd immunity for certain people, like for certain populations, there's herd immunity through vaccination.
Yeah.
And then for others, it's through getting the illness repeatedly. And when it's all said and done, which one helped? The answer is both. Which one is more dangerous and reckless? It's getting inoculated by a virus instead of a vaccine. There's a great website, historyofvaccines.org, great timeline of vaccines. And if you look back, one of the first physicians who wrote a letter to a government stating, really, we should be pushing vaccinations and it is reckless to allow people to just get sick with smallpox was in the early 1800s. So physicians have a pro-vaccine bias. There's no way of getting around it. That's something a lot of anti-vax communities say. Oh, you're biased. You have an agenda. The truth is, the agenda is just to do what I do every day, which is vaccinate kids. Infant mortality, child mortality since 1800s. Just to put it in perspective.
Sure.
In the 1800s, out of 1,000 children, 46% of them did not make it to their 5th birthday. In 2020, 7 out of 1,000 did not make it to their 5th birthday.
Wow.
So
medicine has come a long way, right?
Yeah, and so when it comes to losing the objectivity in your own child, for example, with 103 fever, you may be fearful that your child is about to have a seizure. And honestly, 25 years ago, 30 years ago, that child may have had bacterial meningitis at age 2, at age 3. But nowadays, as a physician, I don't have to worry about bacterial meningitis in a fully vaccinated 3-year-old. So if there's 103 fever, 104 fever, for me, I'm just saying, what does a kid look like? Because sometimes we as adults with a 99, we're knocked out for a day. But kids with a 103 fever, they're just sitting there doing what they do. They feel warm. They're kind of cranky. But of course, sometimes kids do look pretty sick. Again, not downplaying anything. But the truth is, as a physician, I'm blessed. I can't imagine what it was like being a pediatrician 30 years ago when my dad was in his heyday, sending kids to the hospitals for lumbar punctures just to make sure they didn't have bacterial meningitis. Going back to needing antibiotics. Nowadays, we don't need antibiotics as much because of vaccinations.
Interesting. Huh.
Oh, yeah. Vaccines are the fact that we don't have to talk about diphtheria. There were times where diphtheria would wipe out kids in a town. A time where, and actually when I moved to California in 2010, there was an outbreak of whooping cough. And the whooping cough to you and me is a hacking cough for 100 days, which is a long time. You lose your voice. You can cough so hard you break ribs. But for babies, they literally stop breathing.
Yeah, of course.
And so I can tell you in my first 6 months of residency, so many kids were getting tested for whooping cough. I got bored of it. I was like, oh, another whooping cough test? This is probably going to be negative. This is probably... And that's where we are with the pandemic. We have a lot of physicians, a lot of people in general with just fatigue of the same thing. And a lot of it can be fixed with vaccinations. And nowadays, going back to 2010, there's a new recommendation. All new parents, all moms, all dads, all close contacts of infants should get a tetanus. I'm sorry, it's a tetanus diphtheria pertussis shot, but it's for the pertussis, so a Tdap vaccination. So how do we prevent certain things? It's prevention. Or how do we make sure certain things don't happen? It's prevention.
It is prevention.
And same thing with the pandemic. It's not we're waiting for a pill or we're waiting for an infusion. It's keep your hands clean,
Don't touch your face.
Yeah. Behavior change.
Sure.
It's always behavior change.
Mm-hmm. Yeah, no, it's interesting, right? Because like most people don't have the health literacy, I guess, right? Is the right term, right?
Health literacy is a big deal. If you don't know what health literacy is, please Google it.
Yeah.
But when it comes to health literacy, this is actually one of the initiatives of the CDC. If you look at the CDC website, they have a lot of public health initiatives. Before COVID existed, the CDC existed, and health literacy is really important. It's not surprising that there's been a lot of issues in this pandemic because a lot of people do not know how to navigate the medical system.
Mm-hmm.
Even nowadays, you get a prescription for something, you take it to a pharmacy. It turns out if you just go to a website, goodrx.com, and there's others, you can pay a lot less just by knowing that website exists.
Yeah.
And that's interesting enough. I can tell you an anecdote. When I was in medical school, in an emergency room rotation in Austin, I'll spare you the gruesome stories that I had there. But a lady, again, having commented on my age and my appearance before she was getting discharged, she said to me, "Let me take down your full name. I want to submit your name to Grey's Anatomy." And I said, I don't think that's how that show works.
I'm having dinner tonight with somebody that played a doctor on daytime television.
Oh, wonderful!
Yeah, right.
Yeah,
it's interesting. Right?
Well, if that person ever needs help pronouncing certain things, you can give them my number.
So my point about the health literacy, right? So my health literacy is based upon my life, right? So I lost both of my grandparents from COVID, right?
Oh,
they're both not vaccinated. The vaccine wasn't even out at the time, right? And then, then my two boys ended up getting, and they were fully vaccinated. I got it, right, during the first version of COVID. And my whole thing was I just lost my sense of smell. That was it. Didn't have a fever, didn't have cough, nothing. Just I knew I had something wrong with me because I make coffee every morning and I smell my beans and they just didn't smell nothing, right? That's how bad extreme it was. And so when we went and got tested, a whole family obviously got tested, and sure enough, I knew I was going to be positive, right? It was pretty obvious. But then later on, after everybody was vaccinated, and my two boys ended up getting it again, the second variant, I've got a choice to make with my daughter, 5 years old, right? And I'm like, what do we do, right? A lot of people are holding out, don't know what to do. And knowing what the extreme of seeing my grandparents, being buried as a result of it with my two boys kind of now in the house, we just went and got her vaccinated, right? And I think it was the best choice we probably could have made. Would you agree to that?
Certainly.
Yeah.
I think
she's only 5, but
when it comes to the question of vaccines, and people ask, why vaccinate kids if a lot of kids aren't dying? Well, first of all, okay, thousands of children are not dying, but it's almost 1,000 at this point.
Yeah.
But it's not all about death. It's about whether or not when you get the virus, because we're all going to get the virus, we may even stop checking for the virus at some point. Do you want to have protection against it? And nowadays, the virus is a human virus. It's less weird than it was 2 years ago when it was a bat virus.
Yeah.
And whether it came from a lab or came from a wet market, that's not for today. But what we know is it belonged to a different species and was doing a lot of weird things. So the fear was justifiable, certainly at the beginning. But nowadays, it is less virulent. It is causing less weird issues, if you will. But a lot of that is also showing to be the case that it's less in vaccinated people, including children. So if you're hearing this, please vaccinate your children.
And at what age, though? 3 years old?
Well, right now it's approved for 5 and up.
Okay.
And hopefully it'll be approved for 6 months and up. I can tell you that I vaccinated my 2-year-old and my 4-year-old.
You did?
Yeah, I wanted my family completely vaccinated. When it comes to this pandemic, and an interesting thing about the pandemic is, it affects so many people, but illness happens an individual at a time. So you really have to protect yourself. And as a parent, you have to protect yourself and your children. And when it came down to it, I knew it was safe. I'd already vaccinated hundreds of adults before it was approved for children. And then when we were vaccinating children, and also for myself, it was fine. I had arm pain for a day. Now, there are some adults who were feeling very knocked out. But remember, when you feel knocked out by a virus, let me start over. When you feel knocked out from a vaccine, it's your own immune system, making that immune response. So, when you feel cruddy the next day, you at least know something's happening.
Yeah.
For those who have no side effects, not even arm pain, you're like, oh, I hope it's working.
Exactly. Yeah.
But yes, I would recommend it. And if you decide not to, again, discuss with a trusted individual. One of the big frustrations for me during this pandemic is how many patients would come in and say, no, I don't want the vaccine because, of all the things I've read on the internet. And I tell them, well, I'm here in front of you now. Going back to what I said, I've read the phase 1, phase 2, phase 3. Mm-hmm. I've vaccinated thousands of children. What questions do you have for me? And sometimes they don't have any questions. They just say, no thanks. And I say, okay, well, know that I recommend it, and I'm here, and we have it. And when you're ready, come on.
Got it. That's good advice. So I hear you got an interesting ancestry story.
Which story?
An ancestry story.
Oh, yes. Yes. So
tell me more.
For me, going back to our own experiences, I tend to learn a lot from recent history, and I feel blessed to be an American today. My grandparents emigrated from Europe, from different parts of Europe, escaping persecution. Were Jewish. Mm-hmm. My grandma, on my mom's side, has a harrowing tale of survival with her mom and her dad, traveling from Austria, getting kicked out, and traveling eastward towards the United States, going from Austria to Turkey, excuse me, from Austria to Turkey, through Syria, through Iraq, and then living in India for a few years, and then finally making it across to the United States just to arrive when their visas expired. So she ended up with her parents in Mexico.
Wow.
At the same time, or a couple years before, really, my grandfather, my Papa David, he was born in Poland.
Okay.
And he was, turns out, saved by a dentist who gave him a nose job, who said, I don't like your Jewish nose.
Huh.
And basically changed the way his face looked. And I actually have pictures of that. I'll show it to you guys.
Interesting.
And he spoke so many languages. His parents were in education. His family was in education. There was a school in Lodz, Poland called the Kronstadt School, named after him, or his family. And he eventually spoke 11 languages and was in Belgium. He was asked to interpret for a random gentleman who turned out to be a Nazi, and then he took him to France and says, you're going to be the head interpreter for this Nazi regime in France. And so he lived undercover, basically.
Oh, my God.
As an interpreter, and I have pictures of him with Nazis. Eventually, one day, a Nazi came up and read his whole list of his family members, and he was found out. And it turns out that person said, people like you and me are not liked by our Fuhrer.
Oh.
And he knew it was time to go. Yeah. And so he fled, ended up not getting into the United States, and making it to Mexico as well. So my parents, my dad's parents also fled persecution. They had a great love story. My grandfather moved to Mexico and always sent love letters, and eventually got enough money to bring his then girlfriend to Mexico. She couldn't get off of the ship because of a visa issue, so he got someone to go on the ship with him, get married on the ship, and come down. So my parents are from Mexico.
Okay. But you have Polish descent too, then?
Polish, Austrian, Lithuanian.
Is that right?
Yeah.
Huh.
So
fascinating. And so you still have families in Mexico too? Or?
A lot of family in Mexico.
Okay.
Yeah, which is great. Getting to grow up going to Mexico, speaking Spanish. And,
sure.
And Spanish is my first language.
It is, huh?
It's helpful.
I couldn't even tell.
Most people cannot. And flying under the radar, with Mexican descent is cool.
Well, that probably comes in handy as a doctor in Texas, right?
Yeah, and in California.
Sure. And in California.
It was a dream not having to use interpreters. So just being able to speak to more people, again, such a blessing.
Sure. Gratitude
for my education and gratitude for my upbringing.
Do your children speak Spanish?
They do. They're working on it. My children, my daughter Fiona was a lot of no español for a while, but now she's in a dual language program in Houston where she's learning Spanish. And she's showing interest, and my 2-year-old is speaking a lot in Spanish, and so my 4-year-old is kind of like, oh, I better start speaking Spanish. So everyone's getting into Spanish, which is just lovely.
It's always that thing, right? I've got a good buddy of mine. that his parents are Spanish, Puerto Rican, right? And they didn't speak Spanish to him. So here he is, that's his whole culture, right? And he just doesn't speak Spanish, right? That's like one regret that he has, is that he doesn't speak his native language, right? So that's
I went through a phase where I did not want to speak in Spanish. And then I went to visit my cousins in Mexico, and they started calling me the gringo. And I said, I better start learning Spanish. And I came back home. I said, Mom, Dad, I honestly don't remember how to speak Spanish. We need to work on it. And thank goodness we did that in high school, because now I speak more Spanish than English most of the time at the office.
That's awesome. Well, we like to do a thing at the end that we call Hennessey Heart to Heart. Very simple. We just ask questions. Whatever first comes to your mind, you just fire back with. All right, so we'll start off. Who is your hero?
Oof. Honestly, my Papa David and my dad. Both overcoming adversity. My Papa David, who, as you heard briefly, just had to live sort of a double life in order to survive and make his way to to this side of the world. And in the meantime, helping a lot of people cross borders, including his family, getting them visas through his connections in the government in France. And then my father, overcoming adversity of growing up. His mother died at age 5, and then he moved to the United States and had a decision: should we go back? And then didn't. And so all the decisions that they all made to get me to where I am today, and to realize that the problems that I have today are a little bit different, but still legit.
Yeah.
But my close ancestry really means a lot to me.
Sure. Yeah. What drives you?
I think what drives me is just setting a good example for children and for others. You know, the term influencer is thrown around a lot, and nowadays an influencer can mean so many things, and for some people it's on social media and holding up a product in the background, but for me it's just influencing people by doing the right thing at all times, as much as I try. I'm not perfect.
Even when nobody's looking.
Even when no one's looking. But it's just doing what's right, because it's just such a great thing. Like, life is a great thing. And sometimes you learn that the hard way by going through some hardships. And this past couple years have been pretty difficult for me on a mental health note. So please take care of your mental health, people.
Sure, it's so important. If you could go back in time, what year would you travel to?
I would go to 2007.
Yeah?
No, I'm just kidding. I always joke that 2007 was the greatest year for music, but I'm sure everyone has their own thoughts that their music from their teenage years and young 20s is the greatest for music. But
yeah.
A lot of Death Cab for Cutie back then. No, I think I would go probably to the 60s just to experience the hippie movement.
That'd be cool.
I think that would be fun.
Yeah, I think me 50s.
50s?
Yeah, I think the 50s for me. It'd be cool to kind of go see Elvis and like grab a milkshake and see, just kind of live that life, the doo-wop life, I guess, for a little bit. What's your go-to karaoke song?
A lot of times in my early 20s, it was Rapper's Delight, but then I realized people probably don't want to see me singing for 12 minutes. But it was a lot of Rapper's Delight.
I think it was Bust a Move for me back in the day. I don't do too much karaoke, but yeah, Bust a Move. What makes you laugh the most?
My kids.
Oh yeah, that's for sure.
The things that come out of their mouth sometimes is just so funny, and it's just great. And not necessarily my kids too. I'm blessed to be able to have conversations with so many other people's kids. So just asking kids questions, especially when they come in sick, the parents are eager to tell me the story, but I want to hear it from the kids.
Yeah,
I want to hear it from the 5 and 6 year olds, and they tell me that they took this and they felt better, and they, and then I put on a Band-Aid and my pain went away. It's the best.
Yeah.
And so just hearing what they have to say. Sometimes I want to hear what they have to say more than the parents.
Of course. Yeah. So my daughter and I, like Sunday, our thing is we watch America's Funniest Home Videos, right? And she just cracks up. Like, she sits there and watches the show, and person falls, there's dogs running around, and it's just, that's our thing, but it's so fun to just kind of sit and watch her kind of take that in and just laugh, right? Mostly at other people's expense. What makes you angry?
Ignorance.
Ignorance.
Yeah. I can say that plain and simple. I think that people are too close-minded sometimes. Oftentimes they hear something new and the initial reaction is, no, that can't be right. Mm-hmm. I wish people would open their mind and say, okay, let's see how this could be right. And a lot of times it happens to be an opinion. And nowadays, unfortunately, ignoramus also have loud microphones and followers and influence and ignorance.
Yeah. Good answer. How would your friends describe you?
I think they would say I'm jovial. I think I tend to try to make people laugh. Hopefully not at my expense or other people's expenses. And just I think they would refer to me as just a good person. Okay. I think.
Yeah. Well, that's what you live for, right? You got one character, right? Yeah. One shot. What's your favorite thing to spend money on and why?
My art is one of my favorites.
Is that right? Art collector?
When I lived here in LA, I watched the show Exit Through the Gift Shop. Not the show, the documentary Exit Through the Gift Shop. Got really into street art, graffiti artists. I got to meet Mr. Brainwash here in LA. That was pretty cool.
Cool.
And since then, I have a little bit of an art collection. It's certainly not nothing that's going to probably be in a museum, but I definitely try to own some pieces of some artists who are in museums that are that I can't afford. And then when I go to museums, I say, see, I have that.
I think mine would be sneakers. Yeah, that's definitely my thing. Yeah, and it's my kids' thing too. So both of my boys are into sneakers. I'm into sneakers. I don't know. It's just one of those things growing up.
It's sneakers, Jordans on a Saturday. That's the thing.
Yeah. Trying to find some of those really hard to get, sneakers. Yeah, and then when you walk around, like people appreciate it, right? Of course. They appreciate it. Do you usually follow your head or your heart when you make decisions?
Well, since I've started meditating, I believe I've been following my head in that I talk things through, I reason things through. But in the end, it's the heart that leads the right way, and then you really have to make sure your head is also in the same place. Mm-hmm. So I think people in general, I think one of the things that has helped me over the last year is mindfulness and meditation and trying to respond and not react. Mm-hmm. So I guess you can say it's the mind-body connection that I've been working on for myself. And so I guess now I would change my answer where it's both, because I have the connection, I think, in a good place.
Do you use an app for meditation?
I got an app gifted to me for a year. The subscription has since lapsed, but I meet up with a group on Tuesday nights at 8 p.m. And we meet up via Zoom. Okay. And we've been doing it for the better part of a year at this point, on and off. But lately, I realize that when I don't do it,
you notice a difference.
I notice a difference. The people around me notice a difference.
Interesting.
It really is interesting.
Meditation, powerful. What's your favorite type of foreign food?
I think sushi.
Okay.
I was introduced to sushi when I was in my 20s, and I just thought sushi was cucumbers and avocado because I wasn't into fish at the time. And slowly it's become, something that I'd really like to eat. Of course, Mexican food is a favorite as well, but growing up I ate a lot of chicken and rice and beans, so I like to venture out. Got it.
What would you say is your best phase of your life, the best phase of your life up until this point?
I think my entire 20s I think I was blessed. I was told by my cousin, who's nearing 50, know who you are. And I didn't understand what that meant. And during my 20s, getting to party, learning in college, but also outside of the classroom, and then in med school, getting to talk to so many people and learn so much about everyone's different experiences, and just traveling at that time. Mm-hmm. And so by the time I was ready to move on and become a physician, a married person, I was ready. Yeah. And so and going back to the pandemic, we've all been affected, but I often tell my patients who are in their teens and early 20s, I really feel as though they have had the biggest disservice. Sure. If I was to tell you, you're going to have 2 years of your college be virtual or not have parties and not have this.
Yeah,
it's tough. And so when all the stories were, outbreaks in this college and that college, it's like, yeah, it's gonna happen. Kids are gonna be kids, and they're young, and they're learning.
No, it's sad. We've dealt with it, just high school, but still, college is probably different. What do you think is your favorite family tradition?
I think just getting together in large numbers. We're blessed to have a big family from all over the United States, and then cousins who marry. We all become family, cousins of cousins. One of my favorite LA stories when I lived here was I went to a function of a cousin, and the seat next to me was for Cousin Perry, and Cousin Perry showed up, and it was Perry Farrell. And I thought, oh wow, that's interesting. And he and I got to talking. I got to tell him that I didn't get to have a birthday party in Austin the year before because he had rented out the place where I wanted to have a party.
Is that right?
And he said, oh, next time call me, I'll be there. I said, okay, yeah, sure. And then he said to me, oh, you're in your residency, so you're a DJ? I said, no, I'm a physician. And I thought, wow, we live such different lives, but it was so great to be able to,
That's
to
hilarious.
meet Cousin Perry that day.
So cool. What relaxes you?
Meditating.
Just meditating, back to that.
A lot of people think that looking at their phone is relaxing and being on social media is relaxing. But I think being able to live in the moment is what can relax you. So whether it's just detaching from your phone and just enjoying what's in front of you. Yeah. And that's really what's been really relaxing me lately.
I think music relaxes me. That's one of my things.
Oh, for sure. 2007, I was super relaxed with all that good music.
All the great music. The NSYNC and Backstreet Boys days, right?
Love it.
What is one thing that you'll never do again?
Canyoning.
Canyoning?
Yes, canyoning.
Explain.
It is basically hiking in canyons.
Okay.
So this was in Switzerland. And unfortunately, GoPros didn't exist at this time, but I really wish they had. But you basically walk in through these canyons, and you come up to a cliff, and the person says, okay, he throws a rock and says, you see where that rock landed? Land there. And so you jump, and you land in there. And so I did it with a bunch of my friends 2 months before we graduated from med school. And I realize now, years later, I would never do that again.
Canyoning. Okay, you hear that? No canyoning. Who knows you the best?
My wife.
For sure.
Oh,
right?
yeah. She knows me at this point, yes. And what a great thing, for her to know when I'm about to react and not respond, and say things like, hey, go take a beat, or I got this for now. So very grateful for Stephanie.
And last question, out of all your accomplishments in your life and all your success, what do you think is the one thing that your parents are most proud of you for?
Well, my mom loves saying my son the doctor, so maybe that. Okay. But it's got to be my kids. Yeah. I think my kids, and that's what I'm most proud of, is being a father. Like a lot of people, that is their pride. But I realize that when it's all said and done, I'm going to get the ability, if I influence people, great. If I become an influencer, which, again, don't want to be, but as long as I can influence my children to be better than me and have a better opportunity than me, and I've had a great opportunity, so I hope that I can provide them a great opportunity for success. Yeah. And my parents just love being with my kids.
Well, it sounds like that. Well, Alex, I really appreciate you coming down here, being on the show.
It's a pleasure to be here, just to be considered an interesting person, because that's who you tend to interview, interesting people, so I appreciate it.
And so if there's any listeners that maybe want to follow you and and continue to keep up with you, how do they keep in touch?
I'm on Instagram at Alex Yudovich MD. To be completely honest, I don't post much anymore. Okay. This pandemic has been interesting for me, being in the spotlight a little bit, being an influencer, if you will, posting on social media has been interesting. Vaccines to me were never controversial. And if I wanted to go into something controversial, I would have been a porn star. So
that's a quote.
So I don't have that much desire to continue posting on social media.
Yeah.
But if you need to get in touch with me, I guess Jenna has my email.
Jenna has your. Well, here's the thing. Like maybe at some point.
But eventually, if I do, I will certainly let you know.
Well, maybe we'll be blessed. You've got a lot of wisdom you shared on this, and at some point maybe I'll publish a book or something.
Yeah, perhaps. That's definitely. I got lots of book ideas for kids and for parents and for grandparents alike. I think one of the things that I'm passionate about is just not allowing the myths of 2 generations ago, or 1 generation ago, to affect our lives. Yep. One of them is, my mom, my dad, who's even a physician, my grandma. You got to put on a jacket. You don't want to go outside in the cold. Well, I personally believe, and I think there's lots of studies that show that we don't get sick from going out in the cold. It's that we get each other sick. We humans get together inside when it's cold outside, and we get each other sick.
That's right.
And if we can learn that from the pandemic and not let that myth go on, that would be great.
There it is.
Myth busting is a passion, so maybe I'll find some path for that.
I would totally buy that book.
Thank you.
Awesome. Well, thanks again, Alex. Appreciate that, and we safe travels back home.
Thank you.